What does the term cirrhosis mean? Cirrhosis is a condition in which your liver is scarred and permanently damaged. Scar tissue replaces healthy liver tissue and prevents your liver from working normally. As cirrhosis gets worse, your liver begins to fail. How does alcohol and other causes actually cause you to get cirrhosis? Cirrhosis is usually a result of liver damage from conditions such as hepatitis B or C or chronic alcohol use. Around 1 in 5 heavy drinkers have scarring of their liver. Alcohol changes the chemicals that break down and remove scar tissue. This means that scar tissue builds up in the liver. Like other viruses, a person becomes infected with hepatitis through exposure to the virus. Hepatitis B and C causes inflammation in the liver. Hepatitis B is preventable if you get a vaccine. However, there is no vaccine for hepatitis C. What are the progression of symptoms for cirrhosis? Decreased white blood cells and platelets in your blood can be the first sign of cirrhosis. Bleeding and portal hypertension can cause blood to be redirected to smaller veins. Strained by the extra pressure, the smaller veins can burst, causing serious bleeding. There are 4 stages of cirrhosis. Stage 1 is steatosis. The first stage of liver disease is characterized by inflammation of the bile duct or liver. As the body strives to fight against the disease or infection, abdominal discomfort is normally the first symptom of inflammation. If this inflammation is not dealt with, it may cause damage to the liver, making the illness worse. Symptoms and inflammation are more likely to be curable during stage 1 and can prevent liver disease from moving to stage 2. Stage 2 is which scarring of the liver is due to inflammation. Many people with liver illness don't realize they have it until they are at stage 2 or 3 because the first symptoms generally aren't noticeable. In stage 2, scarring or inflammation begins to obstruct the natural flow of blood in the liver. This causes the liver to be unable to function properly. But with treatment, the liver may still be capable of recovering, avoiding more damage and slowing the progression of this liver disease. Stage 3 is when this disease becomes cirrhosis. Cirrhosis develops due to the advancement of the liver disease, mainly due to lack of therapy in which scar tissue replaces good tissue in the liver. This process, when healthy liver cells have been destroyed over time, usually within several years, by progressive illness or infection. This causes permanent scarring of the liver, causing it to become hard and lumpy. The liver will eventually be unable to function because of the growing scar tissue. It will make the blood flow through the portal vein and into the liver impossible. When this blood is prevented from accessing the portal vein, it can flow into the spleen, causing additional problems. Stage 4 is liver failure or advanced liver disease or hepatic failure. Failure of the liver during this disease's ultimate stage will signify the end of the liver's function. This will necessitate quick medical intervention to avoid fatalities. Cirrhosis can be diagnosed by a CT scan, an MRI, or a needle biopsy. When a CT scan is done to check for cirrhosis, you are looking for an irregular left lobe of the liver. When looking for cirrhosis on an MRI, the hepatic artery will be enlarged. A liver biopsy can diagnose cirrhosis when the results of other tests are uncertain. The biopsy may show the cause of cirrhosis. Sometimes your doctor may find that something other than cirrhosis may or may not have caused your liver to become damaged or enlarged. Treating the problem that led to cirrhosis can stop cirrhosis from getting worse. For example, using antiviral medications to treat hepatitis C. You may also be advised to cut down or stop drinking alcohol. Or if you're overweight, you may be advised to lose weight. Unfortunately, cirrhosis of the liver is not curable. The liver is a highly regenerative organ, but only if it's still healthy enough to do so and doesn't have extensive scar tissue. Once cirrhosis is present, your liver's regeneration becomes very, very limited. So that means that cirrhosis cannot usually be cured, but there are ways to manage the symptoms and any complications and stop the condition from getting worse, like we've talked about in this presentation. Sadly, I'm very familiar with cirrhosis of the liver, the non-alcoholic kind to be exact. My grandmother passed away a year ago in March of non-alcoholic cirrhosis of the liver. In 2015, her brother passed away with it also. A few months ago, my mother got diagnosed with a fatty liver disease. Eventually, she will have to have a liver transplant. It's not if she needs one, it's when she will need one. My aunt was also diagnosed with this same disease a few months ago. So, for me to keep my risk down, I eat healthy, I drink lots of water, and I exercise. Maybe not on a daily basis, but every other day. I do what I can to help me in my health. As you can tell, this disease is hereditary in my family. And this is why I chose to do cirrhosis of the liver, because I have a heart-to-heart connection with this disease. I now hope you all have a better understanding of cirrhosis of the liver and how effective it can be to your daily life. And I hope you choose the healthy choices to prevent yourself from getting this disease.